So my question is, there's definitely problems with the president's bill from a Republican perspective. They have issues with it, take issue with it. Um, could you, I know you most probably can't speak specifically about what their issues are, but could you talk about how we're working from a bipartisan perspective to make sure that everyone's concerns are being taken care of?
Sure. They do have a lot of problems with the bill, primarily because they've talked about it being government run, and their view is that it puts insurers out of business and moves us toward a single payer model, which they don't want. And by single payer, I mean a system where the government is the only insurer, like you have in Canada or in Britain, and everybody goes through the government to get their medical claims paid, and they think that they don't like that. And most people actually don't like that, and the system is really designed to encourage competition. I think the president has been very responsive to, he said, look, my concern is to get people covered at an affordable rate. And if anyone has any plan other than what I've put on the table that will get people covered at an affordable rate, I'm willing to talk to people. There have been a number of useful suggestions. Some people, the form of the public option hasn't been decided yet. Some people have talked about having a trigger, so if a certain number of people in a state are uninsured, then those people in that state could buy into the public option, but not otherwise. Some people have talked about various other ways to structure it. So I think the president has been responsive. There have been something like a couple hundred amendments to the bill. Some of them have come from Republicans. So where people have put ideas on the table, he's been willing to consider them. I won't go into the details of those amendments because some of them are very arcane about the timing of certain things and what's covered and what's not covered. But he's certainly been open to having discussions, and I think you see more of a bipartisan tone emerging. During the summer, it was very much talk about death panels and all kinds of other things which were really distracting, and Republicans really, some of their leaders said, we want to kill this because it will hurt the president and perhaps mortally wound his presidency, which obviously was in a very good position. But now you're starting to see people, Republicans like Bob Dole, Arnold Schwarzenegger, Bill Frist, who was the former Republican majority leader in the Senate, saying we need to do reform, and we could support some version of what's been on the table, but we have some issues, but let's talk about those. And so I think you're going to see more of that emerge. The polling has been very consistent in showing that 63% of American people favor a public option, 73% of doctors actually favor a public option. The majority of American people believe healthcare is a significant issue that needs to be addressed. 70% don't believe that Republicans have been serious. So those are really bad numbers for them. And so I think we're getting a lot better tone, and I think you'll see that going forward. Does that mean a lot of Republicans will vote for it? No, but I think there'll be a more constructive dialogue.